Experts from New York's Northwell Health visited Guyana at the weekend to perform groundbreaking surgeries for 6 patients battling complex abdominal wall hernias. The abdominal wall reconstructive surgeries were conducted between November 18 and 19th. 4 of the patients have since been discharged, while 2 remain at the Georgetown Public Hospital for observation, although each surgery was a success. While the success of the surgeries is momentous for the patients, it is the 18 local doctors that assisted who will now use the knowledge gained to improve healthcare here. Dr. Ravi Motilal, a consultant and general surgeon, told the newsroom on Thursday that these surgeries delved into the intricate causes and treatments for recurring hernias.
You've had your experience and then someone is adding their experience to it. So it's like layers and layers of knowledge. And in that way, they may have an insight. Instead of approaching it from one perspective, you could approach it from a different perspective. And that's key.
The collaboration was crucial to patient treatment at the hospital because the 6 selected patients had recurrences due to the complex nature of hernia. The hernias occur when one organ pushes through the muscle or tissue that contains it. The experts crafted a holistic approach to treatment with the local doctors. The planning started in July, and the selection process was very complex to ensure that the patients have successful outcomes.
For a lot of these, what we refer to as abdominal wall hernias, where the patient may have had a surgery before for some other reason and then develop a hernia, weakness in that area. When the patient would have had the next surgery for the hernia, they may have put the mesh, what we say, on the outer part of the abdomen. Then there are ways where we can kind of sandwich the repair, which we put a special mesh in between the muscles. And then there's one where we actually can put the mesh inside the abdomen, but that of course requires special mesh. Now the way how we fix that mesh is very, very important, and over the years there have been different techniques to do that. And that's where the teaching this weekend came in.
Dr. Adhikar Ramju, the senior registrar for general surgery, said the planning for these surgeries meant that pre- and post-operations patient care had to be carefully done, but the most crucial part was ensuring that resources were available. Dr. Ramju said a special material used for the hernia treatment was not available. Northwell Health gifted the material, which will be used for future cases.
The team in Northwell was able to go over these scans around the patient history and determine which patients the team will be feasible if they operate on in Canada. As in some patients, corrections may not be feasible here also. Then we start to make planning and talking about the special equipment is needed and how we can these patients out. Patients will then sent to the anesthesia clinic to get clearance to ensure that when the operation is done, they have the best possible chance of not recurring again, also to survive the surgery.
The team from the Northwell Health featured Dr. Gynosuke Sugiyama, Dr. Sebastian Strorental, and Dr. Samir Sibai. These doctors possess world-class training attained through their work in various countries. The doctors at the Gphc gained knowledge that might not have been attainable otherwise to address complex medical cases. Reporting for the newsroom, Lazina Yearwood.